Okay, so the first thing I'm going to be doing is performing hand hygiene. And then I'm going to review the paper MAR and allergies. I'm going to obtain all of my supplies and head to the Pyxis room. I'm going to review, I'm going to do my first med check by reviewing the paper MAR and make sure I'm selecting the proper medication from the Pyxis. My second med check is comparing the label to the MAR to make sure that I'm grabbing the right medication. And I'm going to do the same with my second med. I'm going to compare the label to the MAR to make sure that it is the correct medication. And then I am going to clean the top of my IM medication with an alcohol swab. I'm gonna wait a second for that to dry. Okay, and then I'm going to insert the equal amount of air that I plan on drawing up into the vial. So I'm going to take this off. Inject the air, and then pull out the same amount that I plan on injecting. Pull straight out. And then I'm going to recap my needle by putting the cap on the table and just lifting up like that, making sure that it's secure. And then I am going to take my medicines and my supplies to the patient's room. Okay, I'm gonna perform hand hygiene again. Hi, my name is Adriana. I'm gonna be your nurse taking care of you today. Today we are gonna be doing a medication administration. It'll take about 5 minutes. I'm gonna close the door for privacy. I'm gonna access the MAR, ask the patient what their name and date of birth is, and check their armband to make sure I have the right patient in the MAR. I'm gonna ask the patient if they have any allergies. And then I'm going to perform my third med check by comparing the label of my med to the computer, and I'm going to scan it. And I'll do the same with the oral meds. I'll scan that. So once I know that those are the right medication, I'm gonna go ahead and give the patient a cup of water and the oral med. So this is 1 tablet Benadryl that you'll be taking. Okay. And then I'm gonna stay by the patient's bedside to make sure that the patient swallows it. And then I'm going to be putting on clean gloves. So I will be doing an IM injection. I'm gonna locate the correct site. So I'm gonna be doing 2 finger breaths under the bony process up here, and then it'll be make like a triangle, and that is in the middle of that is where I will be going. So I'm going to clean that spot with an alcohol swab. I usually clean for about 30 seconds. And then I'm gonna wait for that to dry so that the injection doesn't hurt when it goes in. I am going to go ahead and get my bandage ready for after. And I just like to put that on the side. Okay. So now that I've cleansed the site, I'm going to uncap my needle and I'm going to use the Z-Track to deplace the skin. So I'm just going to put my hand here and push back the skin, and then at a 90-degree angle I'm going to inject the needle and insert the medication at a rate of 1 milliliter per 10 seconds. So I'm going to wait a second to withdraw the needle and pull back immediately and initiate the safety. And I'm going to place the bandage over the place I injected it at. And then so I apply the safety, and I'm going to make sure I place this, my needle in the sharps container, dispose of any of my utensils, and perform hand hygiene again.